Word that clean needles are being given to drug users on the streets of San Francisco is creating a full-blown debate tonight. Some say the practice is a lifesaver. Others call it genocide. News Center 4's Wayne Friedman reports.
It's been just one day since members of Prevention Point went public about what they do on these streets, seeking intravenous drug users, illegally swapping old needles for new ones to stop the spread of AIDS. As one junkie says,
"To me, it's life. You're giving life. They're giving life by giving out free needles."
But not everyone agrees. Several minority leaders call the needle swapping a misplaced Band-Aid, positive reinforcement for drug abuse.
Destruction is destruction. Fire is fire. And you can't weigh fire in terms of its destructive nature.
Naomi Gray of the San Francisco Health Commission calls it a form of genocide.
You know, poor people are expendable in this society. You know? So that's why I object to this.
But two of the women who passed those needles don't regard their mission as genocide at all.
Not doing anything is a form of genocide, because you look at right now, the minorities are dying right now of AIDS, a lot more than any other group out there.
We're a stopgap measure for some people. You know, it can take a year to be on a waiting list to get into a treatment program. What is the person to do if they're badly addicted during that time?
Tacoma, Washington has a legitimate needle swapping program along with New York City and Boulder, Colorado. They've brought mixed reviews, but in Tacoma it seems to be working.
Studies show that needle exchange programs work, that they reduce seropositivity. How you doing? And that they increase the number of people who go into treatment.
So what began as an underground effort to stop the spread of AIDS among IV drug users has now become a full-blown public debate. There is no agreement yet, but both sides would concur that even the active discussion is progress. In San Francisco, Wayne Friedman, News Center 4.
A South Bay man won a delay today for a court-ordered AIDS test. A Superior Court judge ruled that Glenn Allen Rice does not have to be tested for the AIDS virus until a hearing on constitutional issues March 24th. A lower court judge had ordered the test because a policeman's blood may have mixed with Rice's during an arrest.
Preventing AIDS is also the goal of an underground group here in San Francisco, and it's trying to accomplish that goal by breaking the law. Members offer IV drug users a trade, clean needles for used ones. Shared needles are a known spreader of the fatal disease. And Wayne Friedman reports all this illegal activity is getting some unofficial support.
They move quietly through the streets of the Tenderloin or beneath freeways south of Market, seeking intravenous drug users, swapping old needles for new ones, hoping to save lives.
They feel like this is something that has to be done, that it's going to save lives.
Les Pappas of the San Francisco AIDS Foundation. He's been aware of this street-level effort for several weeks and approves of it.
I think we need to have something like this. I think we need to have more access to needles so that IV drug users don't have to share them.
In San Francisco, the health department has handed out bleach, urging addicts to sterilize their needles. And now, in recent weeks, this underground needle swapping, sometimes in full view of health department windows.
Well, I understand the sentiments, and I have respect for the sentiments.
Dr. David Wardiger even says an official needle exchange program might work in San Francisco if coupled with drug abuse programs, but he stops short of approval in this case.
No, I think they're very well-intentioned, and I have respect for what they're trying to do. In the Tenderloin, substance abuse is a raging problem, and amongst IV substance abusers, AIDS is a killer.
Earlier today, one of those people who swaps needles approached us on the street. He declined to appear on camera, but said the addicts are grateful. We also contacted San Francisco police. A spokesman said the department doesn't plan to ignore the needle swapping, but won't go out of its way to make any arrests either. In San Francisco, Wayne Friedman, News Center 4.
They call themselves Prevention Point. 20 people in San Francisco exchanging clean IV drug needles for used ones. They're trying to stop the spread of AIDS. We told you about them last week. Well, today, two members of the organization talked to Channel 7's Lisa Stark in their first television interview. And she is in the newsroom now with details. Lisa?
Carolyn, the group includes lawyers, doctors, AIDS workers, painters, teachers. Most still want to remain anonymous, but two women have agreed to come forth and talk about the underground needle exchange. They speak as though they are on a mission.
You're saving lives.
It's illegal what you're doing.
I don't know if it is or isn't. And I really don't care if it is or isn't. I'm here to save lives, and if I have to go to jail, or anyone in the group feels if they have to go to jail in order to save a life, we will.
Needle exchange is the missing step in San Francisco, and this city's known as a model of AIDS prevention, and we must do this.
Rose and Tia hit the streets once a week to give addicts clean needles in exchange for their dirty ones. The transfer takes place at night near Bodecker Park in the Tenderloin, as well as 2 other San Francisco locations. The group has been at it since November. They've taken in 1,300 used needles.
I happen to know through my work that I'm dealing with a number of people who would be spreading the virus if they were sharing needles.
For Tia, the needle exchange is a truly personal crusade. Her mother was an IV drug user who contracted AIDS.
And she passed away 2 years ago on Christmas Eve. It is a good way to let out this anger that I have about it, because I figure if there had been clean needles out there when my mother was shooting, or, maybe she'd be here a little bit longer.
The pair says Prevention Point is working, but the needle exchange is illegal. It's a misdemeanor in California to possess a syringe without a prescription. San Francisco police officers will not be ordered to shut down the operation, but may issue citations if they see the group at work.
Yes, we can't totally ignore the law. Obviously, it's there. But we're looking for ways to use police discretion, and we have to look at the resources we have available right now for priorities that are, to me, a much higher scale.
4 U.S. cities are trying needle exchange programs. The one in Tacoma, Washington, also began illegally last summer and was sanctioned by the city in January. The San Francisco AIDS Foundation hopes San Francisco will do the same.
Part of the reason that there hasn't been any momentum on this is everybody sort of throws up their hands and say, it's too difficult. This is a crisis, it's an emergency, and we need to do what we need to do.
The AIDS Foundation is sponsoring a needle exchange conference this Friday to try to convince the city to seriously consider such a program. Meantime, Prevention Point says its work will continue until a city-sanctioned program is in place, and Prevention Point is not revealing at this time where it is getting its needles, but it says it will continue handing them out until some other program takes its place.
All right, thank you. Lisa Stark in the newsroom.
Coming up next, Mike Barry in for Dan Lovett with the local drug users. 63% of you said yes. 37% said no. Of course, this is a random poll. It is not scientific.
Police to exchange dirty needles for clean ones was not unexpected, but the group says there really is no alternative. News Center 4's medical reporter Wayne Friedman has more.
With cameras jamming a press conference, the San Francisco AIDS Foundation began its campaign to legalize needle swapping among the city's estimated 13,000 IV drug users.
A year ago, people weren't even prepared to talk about this issue, couldn't get near it. You couldn't bring it up without a knee-jerk hysterical response. We've seen a little bit of that today, but I think there are strong indications that the environment has changed.
And that change stems from a growing recognition that AIDS is no longer only a gay disease. New figures from the Center for Disease Control show that 1/3 of all AIDS cases come from IV drug use, and of those, 400 are newborn babies.
Save the lives.
Speaking today, experts from across the country. Chuck Eaton, who runs a needle exchange pilot program in New York, where 125,000 addicts already have the HIV infection.
What we've done in New York is to prove that when you give people the kind of help they need to make positive changes in their life, they follow through and make those changes.
Another person in favor, San Francisco's former health director, Dr. Mervyn Silverman. He's no stranger to controversy. He pushed to close gay bathhouses in 1983.
I don't think there's anything more immoral than allowing people to die.
And this man, the star of the show. David Purchase broke state laws to begin his program in Tacoma, Washington. Now officially sanctioned, he swaps 200 dirty needles for clean ones every day.
And if we decide in America, anywhere or in America, that public health is only for some and not for others, then we're making a clear decision that some of us are better than others.
Tomorrow, this group airs its opinions again in a forum at the San Francisco Health Department. In San Francisco, Wayne Friedman, News Center 4.
Joining us now from San Francisco to discuss both sides of this free needle issue, the pioneer you just saw in the Needle Exchange Project of Tacoma, Washington.
I can't hear.
Dave Purchase. And from the Third Baptist Church in San Francisco, the Reverend Amos Brown. I wonder, Mr. Purchase, if you could answer first. Can you
Certainly.
hear me? Why do you feel that your program is successful, and do you think that it encourages people to actually give up drugs?
I think the program is successful first because it takes place where our customers, where the people that need the service the most are, and it's there when they are. And secondly, because all the scientific evidence and all the medical evidence indicates that providing a sterile syringe is the most effective way to provide a barrier against transmission of the virus among IV drug users.
Let's let Reverend Brown respond to that. What's wrong with that? It sounds like a pretty Christian thing to do, Reverend.
It appears to be an act of mercy, but in actuality, instead of being a solution to the problem, it is exacerbating the problem. Already the black community, not only in San Francisco, but in this nation, is under siege by drug abuse, drug warfare.
How does it exacerbate the problem, sir?
Well, you are not dealing with giving people preventive measures. I think we need to be concentrating our energies on getting people off of drugs. We need to be dealing with getting more resident treatment programs in San Francisco. If I were to see a person this evening in my office wanting to go to a resident program to get off of drugs, you cannot find one.
He certainly has a point there, hasn't he, Mr. Purchase?
Yes, but the most important thing about the point that the Reverend has is if there are no treatment facilities available at the present time and the virus is here right now, dead people cannot get into treatment by the time this city and others create larger treatment capacities. The purpose of an AIDS prevention program among IV drug users is to keep them alive until they can get into treatment.
But already, sir, even before the AIDS epidemic came along, and I am one who led the way in this community, particularly from the black community, in addressing this problem. But already before this epidemic came upon us, black Americans, particularly young black males, had become almost an endangered species. 11 years from now, 70% of all black males will be either in prison, on drugs, unemployed, or victims of alcoholism. And I'm saying we need positive programs in our community and not those types of programs that are permissive and create more hopelessness. A person who is on drugs or who's shooting a needle has no contact with reality, is not being responsible. And I think that our number one priority ought to be, as a nation and as a community, working to put people on their feet and to not make them subservient individuals waiting for a handout of a needle.
Reverend, with all due respect to Mr. Purchase, I don't think he means to suggest that that's the only option. What about the idea that you want to keep the men in your community also healthy, even though they are still on drugs? That's one argument that's made. What's wrong with that?
We have not received conclusive evidence in terms of the exact numbers. And I wait to see those kinds of facts that would indicate it is in the best interest of the black community for needles to be given to drug abusers.
Very quickly, Mr. Purchase.
If we wait to see specific AIDS diagnosis and ARC diagnosis statistics in the African-American community, the Hispanic community, the Latin community, the white community, we'll have to wait the next 7 to 10 years, and what we'll see are dead bodies all around us. The purpose of a needle exchange program and AIDS prevention is to keep people alive. That does not prevent us doing any other good in our community.
Thank you very much, both of you gentlemen, who I think each of you feels very fervently about what he has to say. We thank you very much for joining us. I'm sure it's not the last we'll